Hi, I'm Dr. Sheel Patel, and today I'll be discussing one of the most common conditions we see in the office, dry eye syndrome. Who has dry eye syndrome? I often think the better question is, who doesn't? Dry eye syndrome can cause a variety of symptoms, from chronic irritation of the eyes, to pain, to even blurry vision. I get asked by patients many times a day, my eyes are constantly tearing. How are they dry? When our eyes get significantly dry, there's a reflex that causes the glands in and around our eyelids to produce extra tears. The problem is those tears aren't our good normal tears. They don't have quite the lubricating capacity to moisten our eyes. They're actually tears that just stream down our cheek. They may flush out any toxins or irritants in our eye, but they don't actually moisten our eyes in the way that it's needed. It also is a signal that we need to be doing something to help keep them more moist. So to that point, is dry eye syndrome associated with excessive tearing? Yes, it is. It's a pretty common symptom that we see. There are a number of other symptoms that occur with dry eyes. We'll see redness of the eyes, we'll see mucus formation on the surface. Often a foreign body sensation occurs. It even feels like pebbles in the eye. We could get light sensitivity or even blurry vision. So what causes dry eye syndrome? Well, there's a whole host of different causes. It ranges from environmental causes to natural causes. As we age, our glands make less tears and leads to drier eyes. So we do have to compensate for these changes that occur with time. Some of the environmental causes include dry environments. When we're in a car for an extended period of time and we have the AC or the heater blowing at us, that's going to dry our eyes out. Being on an airplane for an extended period of time will do the same thing. Wintertime is notorious for drying out the eyes because the cold, dry air has low humidity, and that will worsen our symptoms as well. When we read a lot or do a lot of computer work, we tend to stare. We don't blink as much as we're intensely focused in on what we're doing. And now with the generation of iPhones and Androids and iPads, we have more and more things to stare at and less blinking and more dry eye. So those are things that we need to take account for. Medications can cause dry eyes. Anti-allergy medications, which can contain antihistamines, also antihypertensive medications to help bring down our blood pressure, as well as diuretic medications or water pills will do the same thing. A number of medical conditions can cause this as well. Autoimmune conditions such as lupus, rheumatoid arthritis, and Sjogren's syndrome all can play a major role in worsening our dry eyes. There's other conditions such as thyroid abnormalities, whether high or low levels of thyroid, Parkinson's disease, facial rosacea can cause that, and various other conditions. Hormonal imbalances can cause this too, as being postmenopausal will lead to a low estrogen effect for women. And that's why women have the highest incidence of dry eye syndrome. Recent eye surgery can also cause dry eyes, and that's why we're even more aggressive with using artificial tears after any eye procedure. Contact lenses can also lead to dry eyes, especially with excessive or overnight wear. Now this gets us to, how do we treat the dryness? That's a whole discussion in itself, especially as there's a number of different ways to treat each certain scenario. And as each individual person comes in, we address their certain factors, risk factors that are in their environment, as well as any medications that they have or any medical conditions that are coexisting. Artificial tears are a good way to start, and you've seen a number of those at the pharmacies and the stores, and we can go over those in detail on your visit. Reducing environmental factors is a key way to help this as well. If you wake up with dry eyes and use a ceiling fan, a good idea would either be considering turning off the ceiling fan or using a nighttime gel to help offset the drying effect of the ceiling fan. Increasing bodily hydration is very important with water, and increasing the hydration, if you will, of the air around you with the humidifier can help as well. There's minor procedures that we can do in the office, from the use of punctal occluders, which help increase the tear level on our eyes, to various other procedures that we can discuss. We can also use prescription medications, such as Restasis, which has been shown to increase tear production, to topical and oral anti-inflammatory medications that are used to decrease the inflammatory effect from dry eyes. Lid hygiene is a very key component of dry eye treatment. We often have clogged oil glands and low-grade inflammation because of the state of our lids. Warm compresses to the eyelids, as well as lid scrubs and a few other therapies, can help decrease this inflammation and improve the health of our eyelids, and secondarily our dry eye. This is just a tip of the iceberg with treatment of dry eyes. At Cape Fear Eye Associates, we have a great team of doctors that are here to help you from dry eye to a variety of different conditions. We're here to promptly detect and treat any of these conditions to help you improve the quality of your life as well as your vision. We hope to see you soon.